So, you're losing your hair. It's been in the news lately, especially with regards to the popular new weight loss drugs.
When I look around this room, I can't help but wonder, is Ozempic right for me?
Some taking the drug are turning to social media saying they're not just losing weight, they're losing their hair.
How disheartening is it when the hair loss is from weight loss? By just losing weight, whether you're on the drugs or not, you'll find you're losing hair. No one's talked about this before until today, and I'm going to provide solutions as well so you can get your hair back. So many people don't understand, why am I losing my hair? Today you'll find out.
If you want to keep that weight off, you have to take this drug for the rest of your life.
And yes, gaining weight and fluctuating weight also causes hair loss. Very few things cause such a high degree of anxiety for my patients as this one. Whether you are on the weight loss drugs or not, but you're losing weight or planning on it, you should watch this video. I'll cover these new weight loss drug issues, but also hair loss in general when you're losing weight. Are you experiencing it? Comment below and let's get started on this one. One thing's for sure, I'm having people reach out to me in unexpectedly high numbers with their hair loss after weight loss. It seems like everyone I know is on Ozempic or the compound version. You may know of semaglutide. I call it semaglutide, but you may have heard of that one more so. And now they're seeing the hair loss. We knew there would be fallout from these drugs, and here it starts. No pun intended, but it's hair falling out. In fact, I can't recognize half the people I used to know. I go to conferences, I'm walking down the street, I see people. When they're on these drugs, they just look different. Different than I see with regular weight loss. Maybe it's the rapidity, in other words, how quick they're losing the weight, but people look different, and we talk about Ozempic face. Ozempic face is now going with Ozempic hair. Let me first cover the drugs and their effects and the hair loss, as this just hit the news. And then for those not on them, the rest of the video will help you as well. But the story overall is very interesting. I'll also give you some solutions at the end. So Wegovy, Ozempic, or mounjara, those are the ones you're going to hear of for weight loss. The latter two drugs, meaning Ozempic and mounjara, they're not FDA approved for weight loss, but they're used and they're very similar or the same as Wegovy. And that's a controversy we'll get into.
So I do have some frustration when there's a shortage.
You know the controversy probably because Hollywood was buying up those drugs, especially the off-label diabetic version, and that's what created the initial stir. It's up to the individual, of course, whether you want to go on these drugs and weigh the benefits of treating obesity against the many risks that are likely to come out, but particularly hair loss. It is temporary, but it's hair loss. And as I've said early in my other videos on this, I have a feeling we'll be crying at some point over this, because these are hormones and they affect many organs in the body. Think fen-phen. You remember that case? In case you don't remember, fen-phen was another weight loss wonder. It went south around the beginning of 1997 when fen-phen unraveled as the biggest weight loss debacle ever. Ultimately, 175,000 claims were filed against Wyeth, which set aside, you ready? $21 billion to settle the lawsuits. Thousands of people suffered serious heart and or lung damage after taking the diet drugs. Are we in for that again? I don't know, but our memory seems to be short here. By the way, many making money off semaglutide, the compounded versions, of which the FDA came out and warned against these compounded versions. They're not going to be happy with this video, but I'm reporting the science. But keep in mind, this is big money.
The FDA has issued a new warning about some of the popular diabetes drugs being used for weight loss.
If you don't know about compounding versions, essentially that is when non-FDA approved pharmacies produce something very similar in a different dose as the FDA approved ones. Where they get the product is sometimes questionable, meaning you don't know the full source. The FDA does come in and monitor these pharmacies sometimes, but they aren't FDA approved medication with standardized production in production facilities. Think bioidentical hormone replacements for women. Most of those are often compounded versions. Again, nothing against them, just understand the differences. I did a whole video and discussion on that when I talked about bioidentical hormone replacements, and in that video I went in more in what a compounding pharmacy is. So Wegovy, Ozempic, and mounjara. Of these three newer medications, only the glucagon-like peptide, GLP-1 receptor agonist, semaglutide, wegovy, is approved by the U.S. Food and Drug Administration for weight management. That was around 2021. Specifically, they're supposed to be given to people with a body mass index greater than 30, or that's obesity, or overweight, which is a body mass index over 27, plus at least one related comorbidity, such as hypertension, type 2 diabetes mellitus, or high cholesterol. Well, almost everyone can qualify for that. So many people in America. Here's the thing, the dosage of that is 2.4 milligrams weekly. Keep that in mind with the FDA approval. When there was a short supply of the Wegovy, because everyone wants the weight loss medication, soon after, I think it was just within weeks of it becoming available, it was off the shelves. Some people turned to the same drug, semaglutide, but marketed as Ozempic, which is used for type 2 diabetes mellitus. But that's a 2 milligram dose. So you need more of that drug to add up to what Wegovy dose is. And in fact, people are taking up to double of that even. So you can see that people start running out of the diabetic version, which was really the same version. People with diabetes who, quote unquote, were dying or really having health problems weren't getting it. And that was the stir. So that is the relationship between Wegovy and Ozempic. Ozempic is the one you see in all the headlines, because that creates the stir. People are okay with people taking the weight loss Wegovy one, but when you start going into the world of the diabetics and taking their life-saving drugs, that creates news headlines. So what about hair loss? Why are we seeing this now? Alopecia, meaning hair loss, was an uncommon side effect in the clinical trials of all of these medications. Of interest, it was more common actually after bariatric surgery. Bariatric surgery is a surgical procedure performed on the stomach or the intestines to induce weight loss. Now, in the clinical trials, 3% of patients receiving Wegovy, which is the 2.4 milligram weekly dose, versus 1% receiving placebo or the dummy drug, reported alopecia or hair loss. Hair loss was not reported at all as a side effect in the trials of Ozempic. That's the 2 milligram dose. In contrast, a review of 18, mostly observational studies, mind you, reported that 57% of patients had hair loss after bariatric surgery. That's a huge number, over half. So, is it the drug causing the hair loss? Is it the rapid weight loss? Or is it even nutritional? Because after bariatric surgery, and certainly people who are consistently on semaglutide, Wegovy or Ozempic, they have weight loss and nutritional changes, and that's likely leading to the hair loss. Hair loss from rapid weight loss is very common and not necessarily the effect of medication itself, but more as a result of how quickly it occurs. And this is how this video applies to everyone. At the end, I'll tell you exactly what to do. But remember, the etiology of hair loss is very, very tricky. It's not easy, and a lot of times we don't even know what causes it. TELOGEN effluvium, or stress shedding, occurs with rapid weight loss. You won't typically go bald with TELOGEN effluvium, but you might find that you may lose a good volume of hair. And you might have patches of baldness, but not totally bald. Acute TELOGEN effluvium is defined as hair shedding lasting for less than 6 months. Generally, hair loss occurs 2 to 3 months after the trigger exposure. Like I said, about 33% of these cases, no one knows why it's occurring. But acute TELOGEN effluvium usually undergoes remission in around 95% of cases at some point. In other words, 95% of people get better and get their hair back. This hair loss occurs in relation to either a physical or emotional stress. Physical, think surgery, pregnancy, illness, a viral illness. We just saw that in 2020, 2021. Or emotional stress. You know what that's all about. You see, about 80 to 85% of the hair is in the anagen or growth phase, 5% is in the transitional catagen phase, and the rest is in what we call telogen or resting and shedding phase. In TELOGEN effluvium, the hairs that are normally in the growth phase get suddenly shifted to the telogen phase, and thus they're in that shedding phase. So what can you do? Patients should always try to keep the weight loss slow and steady for many, many reasons, but particularly with your hair. When it's rapid, that's a stress to the body, and that's, I think, when this hair loss is occurring. Follow a well-balanced diet strategy with ample protein, vegetables, and some fruit. A well-balanced diet overall. Come off of the medication. As some people might choose to do this, it might tell you that yes, that is the problem because you go off the medication, you get better. But when you come off the medication, so do you go off the rapid weight loss and the stressor of the medication. So you don't really know if it was the medication, but by coming off it, often it does make it better. Now, I was talking to a friend of mine. He does hair for all of the stars in Hollywood. They're using exosomes to combat this. Exosomes and microneedling. I have a whole video on exosomes. Exosomes are communicating particles that contain RNA typically that communicate between cells. And you can get exogenous exosomes from other people that have been purified and that are signals to your cells, in this case, hair follicles, to stimulate hair growth. So these are typically not FDA approved for this reason at all. Oftentimes, they're not even made in FDA-approved labs, although there are some labs that are FDA-approved. You want to be careful. So exosomes means a lot of things, but they're signals that tell your hair follicles to go. You also have an option of platelet-rich fibrin, which is your own body's exosomes and stem cells, and you can microneedle or I inject them. There's something called A-cell, which you can look into, and I have videos on PRF A-cell, pig bladder stem cells. Some of my patients also swear by biotin supplements, prenatal supplements. You get hair, skin, and nail type of vitamins. Another one is collagen powder. Collagen powder, people will tell you, hair, skin, nails, and joints. That's what they say gets better. But collagen powder is one worth trying for sure. A combination with vitamins A, C, E, and silica. I have one like that in Plasberry store. Many of you are just on silica supplements. I think that's worthwhile. Many of you are on oils for hair and swear by different oils that you use in the hair. Comment below on the ones that you're using that work. There's also tincture of thyme. Now, you guys don't like this, but basically, if you wait it out, these get better. The one thing to keep in mind here, if someone's having new hair loss, they should see their clinician and evaluate all of the possible causes. You can't just assume it's from the Wegovy, Ozempic, or your hair loss. Your provider will then evaluate underlying conditions like we always do for hair loss: thyroid, iron deficiency, vitamin D deficiency. You want to have an overall workup so you're not missing a different diagnosis and what it really is. Now, you're going to want to watch this video on 1 cup of this to lose weight and boost your energy. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.